ask your leaders, your class president, Alcuin, to have this meeting so we can discuss the surgical requirements and also the set of instruments that you need in order for you to perform your procedures. Okay? So, unang-una, I want you to know that as far as I know, there will be there will be live patients next semester. Okay? So, magkakaroon na tayo ng live patients. So, for our live patients, we need to have 5 extraction requirements. And I will be very strict with the diagnosis, with the assessment, with the management. Okay, with the management. When we talk of management, this also includes the procedures. Okay, hindi lang tayo kailangan mag-exo or magbunot for the heck of completing or complying with our surgical requirements. We are doing this because we need to learn the management of a particular case. Okay, kaya nga bakit ang strict mo sa instruments, doc, ang strict mo sa diagnosis, napaka-strict mo sa assessment, because we are trying to learn the management per se. Hindi lang yung basta magawa mo yung 5 exo, tapos ka na sa surgery. That's not our goal. Our goal is for you to learn the management. Paano ba minamanage ang isang extraction case? And that is the goal. That is our objective now. Okay? My objective is to teach you regarding the aspect of management. Okay? So, if you have questions regarding your live patients next semester, please feel free to ask me. If you cannot talk during our meeting today, just message me. Okay? May question ba regarding our requirements, our surgical requirements? Do you have any clarification? Meron ba? Do you have any concern regarding our surgical requirements? For Clinic 2, there will be 5 anterior or mono-rooted cases. So, pumili na kayo ng pasyente nyo, maghanap na kayo ng pasyente nyo. For your first extraction case, I am suggesting, and also mas maganda na ang kunin nyo either central incisor, maxillary central incisor, or maxillary lateral incisor. Huwag ka munang kukuha ng K9. Okay? Huwag ka munang kukuha ng K9. Yung dalawa lang muna na yon, either of the two, pwede. Doc, pwede po bang sabay? Okay. Here comes now the patient management. Paano mo ba i-manage yung extraction case mo? Isa lang ba bubunutin mo o dalawa? Yun yung sinasabi ko sa inyo kanina. Okay. So we have 5 surgical requirements for Clinic 2, mono-rooted. Okay. And then for Clinic 3, I think there are 15. Okay. And then for Clinic 4, there are 10. And once you are done with your extraction cases, you may now start discussing your odontectomy case. Okay? But if kanina sinabi ko patient management, that this includes the procedures. I will be very strict when it comes to armamentarium. Okay? Ayoko maging dahilan ang sasabihin sa akin, Doc, ito lang po kasi ang kasama sa set na binili ko sa dental supplier. Ito daw po yung surgery set nila. So I will be sending you the complete list of instruments, okay, that we need for our surgical cases. And these instruments, don't worry, pag nag-invest ka sa instruments, yung lahat, kahit bilhin mo lahat yung mga sinabi ko, later on, when you become dentist, pag may lisensya na kayo, you will still be using these instruments. Walang isang instrument sa nasa listahan ko ang maiiwan lang sa box. I am already assuring you na yung mga instruments na yan, hindi yan mabubulok sa box. Okay? So, meaning, yung mga instruments is a good investment. Okay? So, I invited one of the dental suppliers of surgical instruments. I was fair, ito alam ni Dr. Arnold to, no? I was fair in entertaining other suppliers regarding the set of surgery instruments. But unfortunately for the others, okay, they failed to complete the set of instruments. And the only one who was able to complete and who was able to follow the list of instruments that I have made is no other than the company of Dr. Arnold Asaraga and his assistant, Ma'am Raquel. Okay? So, magandang hapon po sa inyo, Doc and Ma'am. Ano?
Good afternoon, Doc JP.
Good afternoon, Doc.
Yes po. So, they are here now so they can discuss their instruments, kung ano yung advantages, ano yung meron sa kanila, okay? And compared to other brands, okay? Pero hindi ko kayo fino-force in front of Miss Raquel and Dr. Arnold. Ayan, nasa harapan nyo, lahat nasa meeting tayo. I am not forcing you to get Amarrijje, in short. Okay? Hindi ito required, pero bahala kayo mag-decide. Kaya naman sila nandito sa meeting natin, because they have the complete set of instruments that I prefer for our surgical cases. Pagka nagsabi ka sa akin, Doc, hindi ko po mabunot. Okay, regardless kung anong ngipin yan. Pag naghanap ako sa iyo ng instruments na kailangan natin sa retrieval at hindi ka makaprovide, paano ang surgery natin? And at end, hindi tayo aabot sa kanon since before you start your case, I need to check your complete set of armamentarium. Pag may kulang ka, pack up. Okay, I'm sorry to say that, pero talagang pack up kasi if worst comes to worst, naputulan ka, nagkaroon ng complication, okay, paano natin itutuloy or i-manage yung complication kung wala kang instruments na hinahanap ko? Okay? So, please welcome Dr. Arnold Asaraga and Miss Raquel so they could present their set of surgery instruments. Good afternoon po. Good afternoon, clinicians. Okay? So, sila muna bahala sa inyo dahil I'll just have my lunch while listening to them.
Okay.
Thank you, Doc.
Thank you, Doc.
Opo, kasi honestly, no, I just came back, I just got home kasi since yesterday, tama, kahapon pa, I was in the hospital. So nasa veterans and then we had an emergency hospital transfer to St. Luke's because my father now is battling with a liver mass.
Oh.
Although it is inconclusive yet of a carcinoma, but we are expecting the worst. We know already the size of the lesion and also the complications. And one of the complications that arose yesterday was bleeding. Makinig kayo because this is also included in our topics in OS. So merong hepatic disorder, nagkaroon ng bleeding, and then suddenly the hemoglobin went down.
Sir,
So, we
si Daddy
were-
ba nag-jaundice pa? Hindi naman.
No signs, doc. It was an acute case of hepatic disease. The pathologists, the oncologists, the surgery, the IM, the hepatologists, the radiologists are already in the team because siguro dahil dahil yung kapatid ko is a medical doctor. Siguro if not because of him, wala yung mga doktor na yan. Since doktor yung kapatid ko, all of them are there to discuss his case, and it is a rare case of a hepatic disorder. So we transferred to St. Luke's because they don't have, ito ngayon ko lang nga din ho nalaman to, no? They have this so-called interventional radiologist. So
What is that?
this is yun. Sabi, kakagabi ko rin ho nalaman, ano? They are radiologists who does interventional procedures. Like, ngayon po, ang gagawin kasi, they need to do chemo embolization to the blood vessels of that supplies the tumor. So, sila yung kailangan. Di ba? Parang tayo, pag tumor yan, nasan yung mga surgeon, nasan yung mga oncologists? Meron pala tong isang field of medical professionals that are really specialists, that are really expert to this kind of management. So, upon reading, this is a conservative approach of dealing or managing complicated case such as this. Kasi dahil ang size po nung tumor is 4 by 4 by 5 inches.
Ang laki. Just
Inches,
like- something like
not
this.
centimeter, inches.
It's quite big.
So we know what it means, pero we are still hoping that miracle may happen. So kaya po I'm spending
More time kay Dad.
more time.
Yeah.
Sir, maybe you can announce the name of Daddy so we could offer prayers for him and for the rest of the people in this Zoom meeting. We would really much appreciate for the speedy recovery of Dad.
Thank you, Doc. His name is also my name.
Oh,
I'm
Okay.
Leandro the Fourth, and he is Leandro the Third.
The third, I'm sorry. He's the third. Yes.
Opo.
Leandro the third, Domingo.
And
Leandro Domingo the third.
yes po, your prayers are very much appreciated.
Yes.
yes po.
Yes. Everybody join me later on your own. Let's all pray for that.
Pero while the meeting is on, habang nag-represent sila Doctor at saka sila Ma'am Raquel, no, I'll still be listening. I'll have my lunch, and thank you in advance for all the prayers that you can offer to my father.
Yes. Yes, sir.
Opo, at saka if by any chance naputol po tayo, no, I will still just log on na lang po ulit, join
Yeah.
in ulit sa meeting.
Yes.
Tapos I'll give the host to siguro po sa inyo muna. Tapos so pagka merong gustong mag-join, paki-add na lang po sila.
That's right. Yes, that's right. We made the mistake
Kayo ang
last time.
host para kayo po ang host para pwede nyo i-share yung screen.
Yeah. Sir, kayo ang host ngayon, ano? Tama ba?
Opo, gagawin ko na po kayong host.
Okay. All right. Okay. So we can start anytime.
Okay. So, good afternoon, everyone. Good afternoon, Dr. JP. And on behalf of everybody, we would like to thank you all for having us here today. And our company is IRLR Allied Ventures Incorporated. And we are the exclusive distributor of Amarrijje. So, Amarrijje is a European kind of forceps, and it has all the instruments that you will be needing. We started from resto, perio, we have the syringe, and now since you're on your OS1, so I mean OS subject, right? So we will be discussing to you about your surgical armamentarium, the instruments that you will be needing now. Okay, so anyway, my name is Ate Raquel, and we have our presenter today is Dr. Arnold Azaran.
Good afternoon, everyone. A while ago, pagpasok ko, I think I overheard Dr. JP regarding about the sets of your armamentarium, which is very true. Ang setup ng Amarrijje is nationwide. We have different setup. But for LPU, the only university, dental university, na naiiba ang inyong setup. This is more on a
Hospital-based.
hospital, hospital surgery setup. Bakit ganun? Kasi si Dr. JP Domingo is a hospital.
Yes, Doc, hospital setting.
Hospital setting.
setting.
Yes, that's right. Si Dr. Domingo kasi is exposed siya sa hospital setting, not only on university setting. Meaning to say, mas maswerte kayo dahil parang wala pa nag-o-offer ng ganun. Habang nandiyan niya si Doc JP, honestly, samantalahin natin. I know the mentors of Doc JP, and no need to mention about that, but basically, you're going to be very good. We're going to make two kinds of presentation. One is recorded, and the other one will be live. Yung live presentation natin, yun yung mga add-ons na personally selected by Doc JP. So meaning to say, we did not make it us, but instead this is a request of an educators. Bakit hindi si U3D or any other, hindi sila nakapag-comply. So with this, I hope we're going to satisfy you with all of this. So without any further ado, we're going to start. Now, I'm not very techy. Ate Raquel, can you help me? Which button again to press? Okay, 1 minute.
Introduction to Surgical Armamentarium. The discussion will be on how to differentiate a European kind of forceps to an American kind of forceps. Asepsis method, these are the do's and the don'ts, how you will take care of your instruments. Qualities of Amarrijje that others doesn't have, these are the SSR technology, vacuum heat treated, and of course the warranty that we offer. Innovation versus imitation, how to identify which one are the original ones from the imitation. Nomenclature system, this is the conversion from American number to European number. And last but not the least, ambidextrous, meaning whether you're left-handed personnel or right-handed personnel, Amarrijje is good for you because all forceps have straight handle.
Worldwide, there are only three categories of dental forceps: the screw joint, the box joint, and the scissor joint. The screw joint has its screw on top. A box joint is a metal sandwich inside a box. And a scissor joint is an overlapping metal, just like a scissor. This is a Japanese version forceps. The Amarrijje advantage is that it has shorter beak openings. This gives the benefit of a better vision and a greater working field. Rather than the US pattern, it occupies more space inside the mouth of your patient, thereby losing precious space for maneuvering during surgical procedure. The same thing is true with the Amarrijje short handle distance. The shorter it gets, the easier to apply grip pressure. For better maneuvering, always consider a short handle distance forceps. This is for a less stressful surgical procedure.
In the nomenclature system of Amarrijje, figure numbers are supported in English and in American, such as the American or US figure 150, the English equivalent is figure 01. For the US figure 16, its English equivalent is figure 87, and so forth. All of these extracting dental forceps are supported with these nomenclature conversions, so that you will not get lost in identifying your instrument. Remember to memorize the shape of the bit and its corresponding generic name in figure numbers. Kasi sa board exam lumalabas yan.
Long ago, the only big design available was a groove type. Then it was improved to become a vertical serration, followed by the latest technology, the Puke system, also known as the square profile. These horizontal serrations are the only ones giving a better grip on the coronal area during extraction. Be cautious in using the imitations, as they have a pointed edges profile, which will only damage and break off the enamel structure of the crown, and will eventually make your simple case difficult. Therefore, a square profile or Buke system is most ideal. Looking to our brochure, first, upper anterior. I'm now using a generic term, upper anterior, or figure 150. In English, 01. This is a Buke system or a square profile. We use this on maxillary from canine to canine crossing arch. Always adopt the beak of your forceps slightly above the CEJ, the segmental enamel junction. A 1 millimeter insertion is good enough. The image shown is an exaggeration of the procedure, only to give you an idea on where to specifically position your forceps. Since Amarrijje is a straight-handled forceps, its usage is extended until the maxillary first and second premolar, thereby saving from buying another instrument. Next, upper roots, a slender and curvy beak. Application to all retained roots in the maxillary region. The curvature provides a better access, especially on the maxillary posterior region.
For the molar areas, we have the upper left molar. Take note that the pointed beak is directed towards the buccal aspect of the patient. The rounded beak must support the lingual wall of the crown. This is intended only for the left side of your patient. The standard beak adaptation should engage slightly above the cervical area. A 1 millimeter beak insertion above the CEJ should be enough to hold the entire tooth. For pictorial purposes, the image you are looking at is exaggerated only to give you a visual understanding. Next, the upper right molar. This is the complete opposite of the upper left molar. Its pointed beak should be on the buccal side, while its rounded beak should be on the lingual aspect. During luxation, as you bring back your forceps lingually, the rounded beak will be carrying the entire load in order to gain access to continued luxation. Before you engage in extraction, always make sure that the beak is in the correct orientation.
And now, upper third molar, stout and curvy. In order to reach the posterior far back end area, its application only for the upper third molars. Take note of the beak angulation and the role of the Buke system, as it holds the delicate crown of the upper third molar. Next, lower anterior and premolars. This is indicated for lower incisors and premolars. This dual-purpose extracting forceps saves you from getting another lower premolar forceps. With the fine width of the beak, it can accommodate the slimmest lower incisors, thereby not damaging the neighboring lower incisors during extraction. Moving on, lower roots, long and slender. A 2.8 millimeter beak width, perfect for all retained roots in the mandibular region. Maintaining a slender 2.8 millimeter beak width will get in the socket and crush the remaining roots.
Moving on, lower first molar or cow horn. The beak of the forceps looks like an ovoid cow's horn. This is simply applied to the root bifurcation of the lower first molar. Like the imitations, never use a circular cow horn by mistake. It will only ruin your case and prevent you from extracting properly. This ovoid-shaped cow horn will easily lift the molar as you grip deeper onto the root bifurcation.
Next, lower universal. two similar pointed beaks, dapat sa picture dalawang pointed beaks yun. Pero yung isa mukhang hindi pointed. That's a wrong angle ng picture, so please excuse that. Never interchange the lower second molar forceps with the lower first molar forceps. Do not be mistaken because usually the roots of both molars are bifurcated. However, there are times when the lower second molar roots are fused. So do not take the risk of interchanging the two forceps. Always remember to use the specific forceps for the specific tooth. Once again, here is the plain vertical serration of Generation 1 and the Buick System square profile of Generation 2, the latest technology in dental forceps. Special silicon rubber. The SSR is a promising technology and an edge over the others. Its advantage surpass many normal expectations on a special brand note like anti-rust joint, heat resistance, ISO standard, and food-grade silicon. It is a safe material when ingested by your patient, and this is where you find the special silicon. Up to date, it has never leaked nor crushed on actual test of time. Okay, on the left is an original Amarrijje pattern, and the other one is an imitation. They might look the same, but the angulation, internal parts, and functions are not the same. Both forceps are brand new, but the imitations already has a crack on the handle. With the imitations once found defective, they do not give warranty nor replacement. Here is your evidence. When you split the metal of cheap imitations, we see that the outer rim is intact, but the inner core is void and porous, because this instrument didn't undergo a vacuum heat process to decompress metal stress. This is a technique Amarrijje is proud of. When you split Amarrijje forceps, we see that the metal is solid and fresh cut. Again, this is a result of a vacuum heat process technique. Next will be the soft tissue instruments, retractors, and bone instruments. These are the hand instruments like tissue scrapers, retractor, bone cutters, clamps, soft tissue clippers, gum scissors, and even scalpel holders are all essential and non-redundant to your school requirement because each has its own function and usage.
Now, the 12 dextrose elevators. First, the small, medium, large barbed elevators. Take note that the barbed margin will be the one to initiate the lift or to elevate the tooth. Doon may kapit. Use the bone part as a fulcrum during elevation. Do not use the neighboring tooth as a fulcrum. It will only damage the neighboring tooth. Second, crier elevators. By using a palm grasp maneuver, this gives you a more controlled action during elevation. There are cases when you may find it difficult to determine where to insert the tip of the crier elevator. In order to properly initiate the lift of the tooth, the point tip system only needs a point space between the roots and alveolus. Doon may magandang kapit. Remember to use the bony part as a fulcrum during lift and elevation. Do not use the neighboring tooth as a fulcrum or it will surely damage the neighboring tooth. Avoid calling this the left and right criers. Instead, they are appropriately referred to as the east and west criers. Kasi when using this on your patient, yung left sa mandibular pwedeng maging right sa maxillary. So once again, the correct dental description for the instruments like this are east and west. Third, Miller elevators, a slide system all the way to the wall of the bony socket. For tight and difficult areas, a slide technique is appropriate. Both are good for those with and without crown. Once again, use the bony part as a fulcrum and not the neighboring tooth so as not to create further damage. Next, crane peak elevators, a special elevator mostly used during odontectomy or tooth impaction. After the resection of impacted crowns and roots, a buccal approach is essential in lifting and removing the underlying specimen. Don't forget, we have small and big grain peak elevators. And lastly, apex elevator or root tip peak, best used on retained roots at the apical third. The tiny stem or shank can fit into open sockets to pick the remaining roots. Again, only use this for removing apical third roots. Do not use this on irregular crowns or roots, as it would definitely bend and ruin your instrument.
A dental clinician's nightmare, most especially for neophyte clinicians. With regards to where to adapt the forceps in cases without a crown, this may look difficult, but this is the easiest to handle. With your working tool in one hand and your gauze on the other, use the gauze to absorb bleeding and protect and support the palate to avoid any accidental slippage. Your working tool should touch the other hand in order to feel and gain controlled force of elevation. Start luxating, then replace it with an elevator and gently elevate between the bone and roots. As you feel them, see if the roots were moved, then continue elevating until you see the entire root coming out. As you should always use the elevator first before any attempt of extraction.
All in all, the surgery set is composed of 42 pieces of instruments, which you can keep in this free instrument carrying organizer. This organizing case has 5 layers of HEPA filter lined fabrics that can withstand and filter microns of bacteria, thereby protecting sterile instruments while traveling in and out of the operative area. Imitations which only use ordinary fabric are unable to withstand nor filter even the smallest of bacteria and viruses. Therefore, these are not safe to use as sterile instrument organizers. For the warranty, Amarrijje instruments come with a 3-year warranty against manufacturer defect. Mishandling, normal wear, and unauthorized repair will void the warranty.
The after-sales support. We covered her face to protect her from the malicious YouTube posts. Her house was burned and she asked for help on her warranty. Initially, her request was denied because burnt instruments are not part of the said warranty. However, we helped her justify the case to Amarrijje, Switzerland, and in 2 weeks' time, the entire set was returned to us in good, shining condition. We had thought that the entire set was replaced and not repaired, only to find out that her name was still imprinted on all the instruments, a clear sign that it was indeed repaired. It was even reported by Amarrijje that the instrument survived 850 degrees of heat. With its SSR technology still functional and working, it's a breakthrough incident in dental technology. In the end, we didn't charge her of anything. Nasunugan na nga kasi. Because of that, she was so satisfied and contented that she wrote us a note in big letters saying, "Thank you." Here's another one. Remember Charles? Charles Season? Almost same incident, sunugan din. He went to our office with his mom, seeking for help on his warranty. As you can see, the casing was badly burned. It was so sad. The rest of the pictures were sent to us by his mom, and these pictures I can't bear to see. Kung saan namumulot ng mga nasunog na gamit si Charles and his brother. Though it's beyond the warranty, we took the initiative to expedite his request, and around 80% was returned back to their original shape and condition, while the remaining 20% needed new replacement. Mas grabe yung sunog nito. Being an alumnus, we helped Charles to restore and replace his instruments, and with the untiring effort of his mom, we granted part of Charles' tuition fee so that he could continue his studies. To our surprise, our attention was called by the CEU administration, represented by AVP Jericho Ordina, Siya yung AVP on Business Affairs. And happily joining us on this event was our Dean Pearly Lim. Nakakatawa, may photo op pa kaming lahat as I awarded the check for Charles' tuition fee. From left to right is Ate Raquel, yours truly, Charles, his mom, Dean Lim, and AVP Jericho Ordinance.
To end, these are the universities we are in service to. Here are some group pictures taken from different universities.
Guys, and
Okay. Yes po. Yes.